In this video, I'll be discussing the PLAB 1 or Professional and Linguistic Assessments Board test. I know that there are many of you who want to work here in the UK and you have many questions about what you need to do to make that happen. As a senior clinical lecturer at the College of Medicine and Dentistry, I receive countless questions about how IMGs, international medical graduates like yourself, can start working here in the UK. So although I have not personally taken the PLAB exam myself, I have worked with many IMGs, done my research and support IMGs in my current role as a lecturer. The GMC website is the first place that you should go to, as they provide key information on the exam, as ultimately you are aiming to gain registration with them. If you haven't already, be sure to check out a previous video on how to work as a doctor in the UK. In this video, we will answer the following questions. What is the PLAB 1 test or exam? What are the requirements to book a PLAB exam? Where can you sit the exam? How much will it cost? And how do you book or cancel the exam? Finally, I will share with you 10 tips on how you can smash the exam, including the resources that you need to use. There will be several videos that will follow, which you can click on at the end of this video when they do go live. And welcome back. If you're new, then a massive warm welcome to you. My name is Dr. Baptiste. I currently work as a portfolio GP here in the UK. I provide you with lots of useful content to support you on your medical career journey. So if you haven't subscribed, then what are you waiting for? Hit the subscribe button to stay up to date with all the latest videos. And if you found value in this video, then be sure to give it a thumbs up. What is the PLAB 1 exam? There are two exams, part 1 and part 2. The first part, which we will be discussing in this video, is a written exam, and you do not have to be here in the UK to sit this exam. The second exam, or part 2, is a practical exam, which does need to be taken here in the UK at the GMC Test Centre in Manchester. The PLAB exam is a written exam composed of 180 multiple choice questions. More specifically, the questions are single best answer questions, or SBAs. This means that you have to select one, which is the best answer out of 5 possible answers. You will be given a short scenario followed by the questions. The questions cover common acute and chronic medical conditions seen in A&E or accident and emergency, and primary care or general practice. During my clinical training, I was assessed in this way and did prefer these type of questions to other types of questions, which at the time were true and false and EMQs or extended matching questions. Whilst these questions are not easy, I do think they are very doable, and if you practice and prepare properly, you should pass. So it is a fairly long exam which will require high levels of concentration. What you have to understand about both PLAB exams is that they are looking to see if you are able to demonstrate competency at the level of a doctor who has just completed their foundation year 1. When you graduate from medical school here in the UK, you will need to work in the NHS for 2 years as a foundation doctor, year 1 and year 2. I do talk more about the career path of a doctor in this video, so be sure to check that video out. You should download the PLAB blueprint, which encompasses what the PLAB test covers and what is expected of you when you pass the exam, and then apply for your registration and license to work here in the UK. It includes what you should know, so the range of topics, which is divided into clinical presentation and medical condition. So for example, we have ENT, patient presents with an earache, and the condition could be an infection or something like otitis media. It also covers what professional values and behaviours that you should be able to demonstrate. The GMC strongly recommend that you read the guidance in Good Medical Practice. There is also information on the skills and procedures, which of course applicable to part 2. The document also has a number of links for further reading. If you sit the exam soon after completing your medical degree, you will be in a perfect position to sit this exam because the content will be fresh in your mind. Of course, if you sit it later, you won't necessarily be at a disadvantage. It may be that your preparation time might be a little bit longer. What are the requirements to book a PLAB exam? So you will need an acceptable overseas primary medical qualification. You can check the GMC website first for a list and more information on this, but in short, there is set criteria. It must be in allopathic medicine, so not homeopathic medicine, for example. It must have been awarded after a program consisting of 5,500 hours minimum over a minimum of 3 years. There are also basic training requirements if you do not have a UK or relevant European qualification, plus your qualification must be listed on the World Directory of Medical Schools. But if yours is not listed, make sure you check that you have spelled it correctly, number one. And if you have tried this and it is still not there, then it might still be accepted. Cases where it may be accepted would be if your country is not recognised by the United Nations, or where you studied does not exist anymore or does not teach medicine anymore. The GMC state that they have to obviously be certain that the qualification is valid. Plus, you need to have completed clinical rotations or a clerkship as part of your primary medical qualification, but they do have to be suitable. For example, they must be of an acceptable duration and include both medicine and surgery. There is also information on the GMC website about what will happen if you studied at more than one institution and European medical qualifications. You can still book the exam even if you haven't graduated yet. You will just need to show that you have passed your final exams and met all the other requirements to qualify. Number 2, the appropriate standard of English. The 2 tests that you can take are the IELTS, the International English Language Testing System test, or the Occupational English Test, or OET. Some people prefer the latter because it is more relevant to a healthcare setting. You will also need a GMC online account. This does not take long to do, and once you set it up, you will receive an email from the GMC confirming you have set up your account, including your GMC reference number. You will need your primary medical qualification, passport, email, and postal address. Where can you take the exam? So you can sit the exam throughout the year at specific times. The exam runs 4 times a year in the UK and in a number of overseas locations, hosted by the British Council. You will need to create a GMC online account as above, and when you have, then you will need to look under the My Test section. It can be quite difficult to book the exam due to limited places and demand. So once you book, you will receive an email confirmation. However, if you do not, or you see an error message, you will need to call or email the GMC quoting a specific code. You can cancel the exam if you need to rebook or reschedule the date you plan to sit the exam. There are cancellation fees, and in some cases such as bereavement or related to COVID, the GMC may provide you with a full refund. So bear in mind that costs of exams are just one of the things that can be subject to change. As it stands now, the cost from April 2021 is £240. I also wanted to mention that if you are a refugee doctor here in the UK, you will not have to pay for the first 2 attempts of the PLAB 1 exam. Okay, phew! Feel free to go back and rewatch or pause the video when you need to, because there is a lot of information in this video. Now I will share with you 10 tips to help you smash the exam and begin your journey to working here in the UK as a doctor. Before you start anything, you need to mentally prepare. The first thing I want you to know is that you can do this. You can do anything you set your mind to. With exams, you have passed before you have even sat that exam. It is in the mindset, and I truly believe this. The first medical exam I ever failed was not at medical school. It was my final ever exam as a GP trainee. And one of the major reasons I failed, and bear in mind it was just by 2 marks, was because I did not get into that mindset. I had failed before I even went into that exam. And when I looked back at the cases, I realised I could have easily passed the exam if I changed one thing: how I approached it, my mindset. So before you think about what resources to use or how many questions to practice, you need to ensure that you believe that you can and will pass this exam. If you want to hear about my exam failure and how not to fail, then you can check out that video right here. Secondly, you need to wipe the slate clean, so to speak. You have to remember that although there might be similarities in how you may diagnose and treat patients where you are, or how you have been taught in medical school, there may be fundamental differences in how we do things here in the UK. So try and remember this and learn essentially from scratch. There of course may be many similarities, and then use that to help aid your memory and solidify or consolidate your revision. Finally, you may have been practicing medicine for a long time. You may not have, but I am sure that when you come to sit this exam, you would have sat several exams prior. You may have found a technique of studying and revising that works for you, but what you should never ignore is your gut instinct. Sometimes even outside of medicine or exams, you will have a gut instinct about things. You can't pinpoint what it is, but you know it just isn't, or it is right. So listen to it. This is different, I would say, to your first instinct or choice. You know when you select an answer and change it, and then later on realize that it is wrong, and so you never change your first answers ever again. I know that this is true for me. Well, research does show that if you do change your answer or first choice in an exam, that you may not be wrong at all. You may even be right. As humans, we have something called endowment bias, where we feel a strong attachment to something that we already have, like our first choice or answer. As above, we will feel terrible if we give it up or change it in this case and find out later that it was in fact the right choice. So it might appear that when this has happened, it is more common when current research shows that it is not. Secondly, our first choice is of course correct sometimes, so the challenge is figuring out when it is correct or not. This is where you may need to rely on what your gut instinct or inner feeling is saying. Of course, if something is clearly wrong, then you need to change it. For me personally, in exams where I did not change my answers, I seemed to score higher than exams where I did make a few changes. But of course, this could be down to lack of efficient studying or techniques and confidence. And I'll let you decide. What do you tend to do in your exams? Let me know in the comments below. Understand the exam and question type. I have sat countless exams in my time, and from experience, the best way to pass exams like these is to understand the structure and format of the question type, and then to practice as much as possible. These questions are SBAs. The clue is in the name. Single best answer. Why is this option correct over all the others? Why is this the best answer? First, you need to understand this, find a technique that works for you, and apply it hundreds and hundreds of times. Develop a strategy specific to you for how you are going to effectively study for this exam. Everyone's circumstances are different, and so I personally think it is impossible to say how long you would need to prepare for the exam. Perhaps you can decide on how many questions would be reasonable for you to complete per day and set yourself a goal of when to complete them and then when to sit your exam. Perhaps you feel that it is doable in 2 months. The consensus from those who have sat the exam seem to say anywhere between 1 to 3 months. Practice. This follows on from above. I would not utilize my time by reading lots and lots and lots about cardiology, for example, and then starting to answer questions. No, and no. I tried this once in a pediatric rotation and it did not go down well. I passed, but I scraped that pass. What you need to do is right from the offset, when you start your exam preparation, start with answering the questions, then read around the questions as you go and do additional reading as you need to. Also, make sure that you have enough time before the exam to review what you have learned. You do not want to be learning anything new in the lead up to the exam. In this time, you can review questions that you perhaps found were more difficult than others. Resources. So as above, you need to answer lots and lots of questions, but you may be thinking, well, where do I get these questions from? And are they similar to the questions that may come or may be asked in the exam? So I'm now going to go through some resources that you may find useful and that others have recommended as helping you to pass this exam. Social media. So if you're not on social media, then this needs to change. We are in an ever-changing, fast-moving world where technology plays a massive role in how we live our lives. Social media is getting bigger and bigger and bigger, and there is lots of support on social media. Facebook and WhatsApp groups are just one example. You may receive advice on how to answer questions and why a certain answer is correct and what resources to use. Question banks. There are lots of question banks out there, and it is important you pick 1 or 2 and attempt all the questions. A commonly used question bank that IMG seem to use is Plabbable. When you answer a question in the question banks, there are explanations with the reading, and plus you can do your own further reading with reference books. I will mention these books shortly. This is why, as above, you want to start with answering questions and tailor your revision accordingly. You ideally want to attempt all the questions at least twice, with a focus on incorrect questions, which you can flag or mark to return to later. You also want to ensure you do the questions again with a timed mock test. Timing yourself is important, especially once you have attempted a significant number of questions, as you start building knowledge and confidence. Books. So the Oxford Handbook of Clinical Medicine is the go-to book for medical students here in the UK, at least when I was studying. And this book has pretty much all you need to know if you want to do some additional reading around certain topics. You also want to refer to the Oxford Handbook of Clinical Specialties. Ensure that you have the updated versions, as they are updated quite regularly. There is a book or PDF format of the 1700 questions, which seems to be what most doctors sitting the exam refer to and use for practice. In summary, these are a compilation of questions that are very similar to the questions found in the PLAB exam. You can also use this to focus your revision. Flashcards. So you may have heard of Anki. It is a free platform where you can create your own flashcards. I have spoken about study and specific tips in a previous video, which you may want to check out here. The NICE guidelines are also the go-to guidelines which I use most days in clinical practice. If you want to do additional reading, then this will definitely help you know what is the current best practice here in the UK. Look after yourself. There is no point stressing about this exam or any other exam for that matter. As with the first points above, you need to ensure you have the right mindset. You also need to ensure that as much as you have an excellent revision timetable, that you also schedule time for rest and relaxation. You will not be productive if you are constantly revising with no time for adequate rest. So when you have time to rest, rest completely. This might mean switching off your phone or placing it on silent. Create or find a support network. Exam preparation is not easy, and you may have times when you want to quit. You also may struggle to understand some concepts and answer questions. This is why finding or even creating a support network with people who are going through the same process, such as through social media or locally, will also help you pass this exam. Also, speak to your family and friends who may help you in other ways, such as helping you to unwind after a long day of revising. Work on your communication too. You will of course have to demonstrate your English proficiency, but continuing to work on your communication and understanding the NHS and British culture will also help you with the exam. Check out this video here where I provide you with key information and tips regarding how to improve your communication for working here in the UK. Once you are sitting the exam, ensure you stay calm. Be confident. After all, you probably would have been revising every day for 2 to 3 months and monitoring your progress. Answer every single question. There is no negative marking. In this exam, you will not lose any marks for any incorrect answer, so make sure that you answer each and every single question. If you're not sure, you have nothing to lose. Have a go and select an answer. You may be right. After the exam, try to forget it. There is nothing you can do about the exam now. You will of course have to wait for your results, but you should try to at least enjoy the time you have now, not revising every single day, and try to remain confident. As above, I talk about a previous exam failure in an earlier video. If you have failed the PLAB exam before, then please let me know if you want me to do a video on that too in the comment section below. Hopefully you'll pass with flying colours, and I wish you all the very best. I really hope that you found this video useful, and if you did, be sure to give it a thumbs up and share it with those who may find it useful. Don't forget to subscribe, as in the coming months I'll be posting more and more videos to support you with your journey to working here in the UK. I will see you in the next video.